is Susan Sportsman. I'm the Managing Director of Collaborative Momentum Consulting, and we are so excited to be here today. We're offering our very first podcast, Nurse Educators Now. We will be offering these episodes with experts in nursing in various important areas that nurse educators need to be concerned about. Today, we have Dr. Ashley Hovar, who is a nurse educator who has some experience with ChatGPT particularly. And given that we are all being faced with using this and how to do it and so forth, we're going to tap Ashley's brain to see what we can learn from how to do this in a responsible and effective way. So Ashley, I'm so glad you're here. Thank you very much for showing up and being willing to do this. Let's start off. Would you tell us a little bit about your journey to nursing education and how you got to be this expert on ChatGPT?
Yes, thank you so much for having me, Susie. I started educating nurses as an RN myself through the years, precepting other nurses, and then as a nurse practitioner, also precepting other nurses, nurse practitioner or PA students. And then eventually I found myself tapping into the University of Texas down here in the Rio Grande Valley, leading clinical groups and functioning as a clinical faculty. And then eventually with this small school down in here in South Texas as a faculty, and then for a time, the chief academic officer. So during that process, it was a brand new program, very small, not a lot of hands on deck. And so I kind of was a one-man show for a while, doing everything in terms of the school, from admissions to building curriculum, instituting new learning management systems, you name it. So that was very busy and very time consuming. And I learned quickly how to use my tools so that I could save time and try to spend as much time as I could with the students.
What made you think that using ChatGPT was a way that would be helpful to you? What got you to that place, and what did you use it to help you do?
Well, I will say I first heard about it a couple of years ago. My husband writes, and he and a friend of ours was talking about it. And I was like, wow, what is this all about? So I didn't really mess around with it too much until one of my colleagues recommended, hey, you need to make that rubric for this paper that you've got. Why don't you try ChatGPT? And I'm like, okay, all right, I'll try it. So I just used the free version, which I'm still just using the free version. And I just dropped in information like the parameters of the paper, what I wanted it to include, the type of students that were going to be writing it, what level they were at. And man, it just, bam, just made the rubric for me in like 2 seconds, done. I was able to put it on the school's letterhead and make it look professional, and my job was done.
That is really kind of amazing. I know I have spent a lot of time writing rubrics and that sort of thing. Talk to us a little bit about, because this sounds really wonderful. Talk to us a little bit about the part where your expertise as a nurse educator came into play with using ChatGPT.
Well, I think that portion has to do with the fact that the more specific you can be when you're asking it to generate information for you, the better. So putting exactly where the students are at, or maybe exactly the objectives for a course, or these type of things are going to get you the end goal or the end product that you want. So I think that's really where it comes in, just knowing how to fine tune things, what you're looking for, and what the end goal of your project is.
Did you find it, the information that you got from ChatGPT, did you find it to be consistent with what you had seen or done other places, or was there an opportunity for you to do some other add or subtract or whatever based on what your own school or your own students needed?
Absolutely. So If I asked it to create something for me and it was a little less thorough than I would like, then I could type, okay, now add this kind of information, and then it will regenerate it, adding that, or take this out, and then it regenerates it, that information. Now, I did find that you have to be a little bit careful and really kind of vet some of the information that it gives you, because it's not perfect and it pulls from all areas of the internet. So it may pull old data that is outdated, or there was a time when I did use it to help me create like a drug calculation quiz. And I saw that two of the answers were wrong that it gave me.
Gosh.
So I learned very quickly that I had to actually work those questions out on my own. Now, the questions were great and the whole setup was fabulous, but I had to test and like work out the questions on my own to make sure that the answers were correct.
Wow. Well, that is a really good piece of information to have because, I hope we would all do that, but I can imagine thinking, oh, well, this artificial intelligence must know. Well, maybe
It's a
not, huh?
computer. Yeah. How could it not? No, it miscalculated. I was like, oh my gosh.
Yeah, yeah. That sounds like a really good tip. For those of us who have been around the block a time or three and are probably less comfortable with anything technology. I'm speaking of myself when I'm talking about this, and I'm sure there are many, many nurse educators today that are much more technologically savvy than I. But what is your recommendation for those of us who feel some trepidation in getting started? Is there anything that you can think of that would be helpful for those of us who are maybe a little afraid of what will happen?
Sure. So, in terms of getting used to it, I would suggest just kind of playing around with it. Don't be afraid to add to it. So, let's say you start very simple with your commands or your questions. If it's not exactly what you want, then you can add to it and you can be very specific. Please create a scenario for me for simulation, including a burn victim, using the rule of nines and all of this good stuff. You just as specific as you can be, and then you can add on to that if you need to. The other thing I would say that people don't realize is you can ask it to generate certain formats for you even. So please make this into a Word document, or please make this into an Excel document, or make me a graph. You can even upload, let's say you have a data table in Excel, you can upload that and ask it to make you some nice graphs demonstrating the data that you have, which I actually used for some applications for higher education and things like that. So there's a lot of ability. Just get in and play with it. It's free. You don't necessarily have to put any personal information or identifying information. I know people are afraid of things like that, but it's very easy to use. And the more you play around with it, the more capabilities that you find that it has.
Well, I didn't realize that it would do both graphs and use your data to make those. That's really helpful because that always sounds really hard to do or time consuming, that sort of thing.
Yeah.
I know there is a lot of discussion out there in education and in other areas as well about the negatives associated with ChatGPT. What would you say those negatives are, and what would we look out for?
Well, I would say, obviously, we worry about cheating. Certainly, we want students to engage critical thinking. So we don't want to lose out on that. Reduced human interaction is also sort of another drawback. Maybe you're not going to be collaborating as much with your classmates to get information or to work through a problem. Instead, you just drop it into ChatGPT. And then, of course, when you get a paper written by AI, you can tell it's not the student. Like it's very, and again, finding data that's out of date, that's something that would be a drawback. Of course, I think one of the biggest concerns is this going to replace us? I don't think it ever can. I've seen the limitations and I'm sure it's going to improve as time goes on, but you're still going to have a human in there looking at it. Is this appropriate? Does this match what we're actually asking for? Is this up to date? All of that.
I don't believe ChatGPT will be going to clinical with the students, so I think
No,
I think we're
no.
safe on that.
Yeah.
But I have heard a lot of discussion, and you may or may not have had to deal with this, but I suspect you have some opinions that you alluded to. We read and hear so much about, should we allow students to use this at all? Should we put parameters around it? Should we just let them do whatever they want to? And as you say, you can tell. What is your sense of any kind of parameters we ought to have students follow? And I understand that some of that involves what happens at the larger institution if you're working for a bigger institution. But what is sort of your sense of what's practical and yet provides for good learning?
So I would say that using it for simple things to find information quickly would be a helpful way for students to utilize it. For instance, let's say the students are in clinical and they're going to give a certain drug or medication, they may get in there just to find out how is this supposed to be administered? What are the side effects? What should I be looking for as a nurse? And it might give you fabulous information very quickly so that they can go about their business.
Mm-hmm.
Now, in terms of writing or answering a question that would require surveying the literature and finding all the most current data, I would not want them using it for that, because then we're taking out their ability to analyze data,
Mm-hmm.
analyze literature, and critical thinking, because the more they go through, like, let's say articles for a research paper, the more they're learning themselves
Right.
versus, okay, well, I've put it all here in a nutshell for you. It's almost like having cliff notes that we used to use for reading a book instead of actually reading the book. You're not getting the full sense of, the whole purpose of a project, like a research project, if you were to simply utilize ChatGPT to find information. So I would say it may be variable, and there are some forms of learning that may be appropriate. I mean, even as a nurse practitioner, every now and then I will say, okay, what's the most up-to-date treatment for this, just so I can find it very quickly.
Mm-hmm.
The other thing to think about is if students are going to be utilizing AI in terms of patient care, they have to think about things such as consent. For instance, in my current role, doing telemedicine, I use AI to write my note for me while I talk to my patient. And I actually have to ask them for consent before I do that so that they're aware and can give consent. So if students are in a position where they're using it for work or any type of patient care, they need to remember that this is something that patients have to consent to.
Well, that's an interesting thing that you bring up that I really hadn't thought about, but I can see how that would be. I know I was speaking with a friend who teaches in a doctoral program, and she was saying that they struggled among that particular faculty about what to do, and came up with a policy or a procedure about what students should do when they're using ChatGPT. And one of the things that she thought was so important was that they needed to be able to reference that. I mean, it's not like I mean, you need to say it's not yours. And so that is one of the things that they made particularly important for students. And I think it's probably true for all types of using this particular mechanism. But she said, unfortunately, then her larger university decided that they wouldn't allow students to use ChatGPT at all. And so all their work was like, well, never mind. And we discussed that perhaps telling students not to use it at all is not very effective. I mean, I myself go to various sources, Google or Google Scholar, whatever, and say, put in whatever I'm looking for as a way to
Mhm.
see what points are important in the area and what I need to consider and that sort of thing. So I don't know what your thought is, but I think it's sort of foolish for us to think, no, 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 you can't use it, because probably they will.
Yeah, I mean, I think in some ways it could save a lot of time for students, versus having to go and use EBSCO, which if anybody's used those databases in the past, like sometimes you have to take a class just to learn how to utilize the database appropriately and figure out what terms to put in and parameters. It's a whole thing. I remember in nursing school having the school university's librarian come and give us a training on how to utilize EBSCO and all these other databases. So if you were to just, let's say, have a student go in ChatGPT and say, give me all of the most recent literature pertaining to this and this, and it pulled up evidence, now that would be a whole different ballgame.
Yeah. Well, I think there's a lot of reasons for us to embrace this, which is part of the reason why we're talking about it today, because I think we all need to be able to do it. And so students will do it as well. And so we need to be sort of aware of what's going on in the real world, because they certainly will know. Do you have any final suggestions about how nurse educators, sort of the parameter, the range of things nurse educators could use this for?
Used it to, as I've said, like write rubrics or even write emails that if I want my email to, a colleague to sound anything, it's limitless, honestly. Utilize it yourself in terms of saving time and learning, and know that the students probably are going to be using it, and maybe foster a very responsible approach to that within your students, because they're using it. I promise you. Use it yourself so you can see, like, what is it actually pulling up? Like, if I ask it to pull up some research articles for me, what are they going to be seeing, so that you can be ahead of the game? There are certain things out there, like if you're concerned that your students are utilizing it for writing papers and they're not supposed to be, there are free sites that you can use, such as AI Writing Check, GPT-0, Merlin AI, and you can drop their paper in there and say, how much of this do you think is actually AI? I've had professors or instructors that are doing that. And then I've also had students argue back and say, no, I really did write most of that. So we're kind of still in an infancy, I think, but
Yeah.
the earlier we understand it and learn how to use it responsibly, the better.
I think you're absolutely right. And I think that is probably what, as nurse educators, we need to be able to do, is to role model the use of new things, and how do we do it, and what would happen if it goes bad, and all those things, because they will be looking to us. And as somebody who has been a nurse educator for a long time, I think it's pretty easy to say, oh, gee, we're not going to do that, because frankly, I don't want to. I'm a little scared about using it, and I think we're not giving the students everything they need to know, not the least of which is just a role model, that we always have to learn new things. We can't remain stodgy. We have to keep moving on. I thank you so much. Is there any one last piece of information you'd like to give us that we haven't talked about yet?
I would just say that, I think one of the most important things that I learned when I was in school myself is how to find information. If I didn't know something, how do I find the information and the correct information? And that's by utilizing your resources, whether that be your textbook or Google Scholar, or in some cases, AI. And now this is a new resource, and I think we need to learn how to utilize it.
Well, I absolutely agree with you, and thank you so much for being here to help us think about it. We appreciate your being with us so much on our very first podcast, and we look forward to talking you some more at a later time. Thanks so much.
Thank you for having me.